Global Learning for Health Equity project is part of a nationwide effort funded by Robert Wood Johnson Foundation and managed in collaboration with the University of Maryland, Baltimore. It is designed to explore how global ideas, especially those from low and middle income countries, can be adapted to improve health equity in the United States.
We designed a project to learn from mental health practitioners, community leaders, and individuals in Cambodia who have developed innovative and culturally embedded ways of addressing trauma, especially among genocide survivors. Our team traveled to the capital city of Cambodia, Phnom Penh, and other parts of Cambodia as well to engage with local experts and organizations including TPO Cambodia, EMDR Cambodia, Caritas, and the Royal University of Phnom Penh Department of Psychology. We conducted interviews with therapists, community leaders, NGOs, directors, and clients, and we are so excited to be able to engage with them. We have been able to gather a lot of information. Today we had an opportunity to talk to our mental health counselors who have worked a lot with the community villagers. They have with students, children, and older adults. They have shared with us a lot of great experiences about the models that they have used to help people improve their mental health and well-being.
As part of the adaptation process in the project, not only were lessons applied in terms of mental health services in the United States, but also policy recommendations came out of the learning. First, mainstream providers and funders must recognize that culturally responsive care includes spiritual and community-centered healing. And finally, mental health systems should invest in bilingual, bicultural providers from refugee communities and support cross-cultural training. For programmatic implementation, mental health programs will also use arts, storytelling, and food as healing tools.
In doing this project, we applied the Global Learning to Advance Health Equity framework. We made sure to build trust with our partner by meeting with them before departing to Cambodia to explain what we are trying to achieve, to build humility and reciprocity. In doing so, our partners were able to really understand the project and help connect us to many mental health professionals, of clients of theirs, and community members. We traveled throughout the Cambodian provinces to host focus groups. Here are some of the findings we found throughout the focus group. Some of the Cambodian mental health providers are using holistic models that integrate Western therapy, such as EMDR and CBT, with local spiritual practices and traditional healing rituals. We also found that community-based healing through storytelling, spiritual rituals, and group therapy emerge as especially powerful for individuals who might not otherwise trust the formal therapy.
The global learning for health equity is very important because it does not only involve seniors, older adult population in this project. We also had the opportunity to involve youth in the projects, and we are able to learn so much, and some of the findings of the project that we have been able to learn. Our organization is very committed to sharing this finding with other organizations serving immigrant and refugee community, particularly in Southern California and beyond. We are also designing right now a pilot program to implement the practices that we have been able to identify in Cambodia. We have been able to work on advocating for system change, especially in our county and our state, in how culturally rooted mental health is supported and funded in the county and beyond.
As we conclude our trip, I want to first thank the Global Learning for Health Equity from the University of Maryland, Baltimore. This trip has been an eye-opener for myself, for the Cambodian family staff. We have learned so much here about the mental health system and found that we're no different in United States.
We have learned a lot from our community partners and community members who have shared their invaluable experiences and knowledge about the mental health in Cambodia.
Thank you, Global Learning for Health Equity.
On behalf of the Cambodian family, I would like to express my sincere thanks and appreciation to the University of Maryland at Baltimore for believing in the Cambodian family, for investing in our community, especially one of the most underserved communities in the United States, Cambodian American community. I would also like to thank the Robert Wood Johnson Foundation for supporting this project. Your investment in our community made very significant impact, and we are very grateful for that. Thank you. And Som Akun.